Imagine sitting across from your doctor, feeling completely normal. You have been going about your life, eating, working, sleeping, walking. Nothing has happened that makes you think something serious could be developing inside you. Then, your doctor looks at your blood test. There is a pause. Your kidney function is not where it should be. You are surprised, because you do not feel sick. And that is where one of medicine's strangest mysteries begins. How can the kidneys lose function while the person carrying them feels almost nothing? The answer starts with something remarkable about these two small organs. Your kidneys are not simply filters. They regulate fluids and electrolytes, help control blood pressure, remove waste products from the blood, and perform several other essential functions. And they have an unusual ability to compensate. When some kidney tissue becomes damaged, the remaining healthy tissue can increase its workload. For a while, the system can continue functioning well enough that everyday life feels completely normal. That is useful biology. But it creates a problem. The better the kidneys compensate, the easier it can be to miss what is happening. Imagine a large company losing employees one by one. If the remaining workers quietly take on extra responsibilities, the customers may never notice. The company still opens its doors, the phones still ring, the work still gets done, but behind the scenes, the workload is becoming increasingly difficult to sustain. Something similar can happen inside the kidneys, and this is one reason chronic kidney disease can remain hidden for so long. According to the CDC, chronic kidney disease is common among adults in the United States, and many people who have it do not know they have it. That single fact changes the way we should think about kidney disease. It is not always a story that begins with pain. It may begin with a laboratory number, a blood test, a urine test, something found almost by accident during an examination for an entirely different reason. And by then, the underlying process may have been developing for much longer. So what exactly are the kidneys doing while all of this is happening? Inside each kidney are millions of microscopic structures called nephrons. These are the functional units responsible for filtering the blood and helping the body decide what should stay and what should leave. Blood enters the kidney. Waste products and excess substances are filtered. Useful substances are retained or reabsorbed. The final result is urine. It sounds simple, but the real system is extraordinarily precise. The kidneys are constantly adjusting the body's internal environment. They help regulate water. They help control electrolytes such as sodium and potassium. They contribute to blood pressure regulation. They also produce hormones and substances involved in red blood cell production and bone health. This means that kidney damage is not simply a problem with urine. It can eventually affect many systems throughout the body. But early in the process, those consequences may not be obvious. And that is the first major clue. The kidneys can lose function before the body produces a dramatic warning. Why? Part of the explanation is compensation. When some nephrons are damaged or lost, the remaining nephrons may take on more work. The kidney can continue producing urine, waste can still be removed, fluid balance can still appear normal. The person can still wake up in the morning feeling fine. But this does not mean nothing is happening. It means the body is maintaining the appearance of stability. And this distinction is critical. Because in medicine, normal function does not always mean normal structure. A person may have underlying kidney damage while the kidneys are still compensating enough to preserve many everyday functions. This is one reason doctors rely on testing rather than symptoms alone. A common blood test measures creatinine. Creatinine is a waste product produced by normal muscle metabolism. Healthy kidneys remove much of it from the blood. When kidney filtration decreases, creatinine can rise. Doctors can use creatinine along with other information to estimate how well the kidneys are filtering blood, often expressed as estimated glomerular filtration rate, or eGFR. But the story does not stop there. Doctors may also look for albumin in the urine. Albumin is a protein that normally remains largely in the bloodstream. When the kidney's filtering barrier becomes abnormal, more albumin can leak into the urine. That can provide another clue that something is changing inside the kidneys. So imagine two people. Both feel healthy. Neither has obvious swelling, neither has severe fatigue, neither is experiencing dramatic changes in urination, but one has an abnormal kidney function measurement, the other does not. Without testing, there may be no obvious reason for either person to suspect a problem. This is why kidney disease can be so deceptive. The absence of symptoms is not proof that the kidneys are completely healthy. But there is another question. Why do some kidneys become damaged in the first place? There is no single answer. Chronic kidney disease has many possible causes. Diabetes is one of the major ones. High blood pressure is another. And these two conditions are deeply connected to the kidney story because the relationship can work in both directions. Long-standing high blood sugar can damage the delicate blood vessels and filtering structures within the kidneys. High blood pressure can also place abnormal stress on those small vessels. Over time, repeated injury can impair kidney function, but this does not mean every person with diabetes or high blood pressure will develop kidney disease. Risk is not destiny, and kidney disease does not always begin with either condition. Inflammatory diseases, certain inherited conditions, infections, structural problems, and other disorders can also damage the kidneys. Some medications and substances can cause kidney injury, particularly in certain circumstances. But this is an area where oversimplification can become dangerous. A medication that is harmful in one setting may be appropriate and beneficial in another. The important question is not simply, which drug is bad for the kidneys? It is, what happened to this particular person's kidneys under these particular circumstances? That is why doctors consider medical history, other conditions, laboratory results, medication exposure, and the pattern of kidney abnormalities together. The investigation is rarely as simple as finding one culprit, and sometimes the most important clue is not a symptom at all. It is a pattern. A blood pressure that has been elevated for years, a blood sugar level that has gradually changed, a urine test that repeatedly shows abnormal protein, a kidney function measurement that slowly declines over time. One number can be misleading, a pattern can be much more revealing. And this brings us back to the person who walked into the doctor's office feeling perfectly healthy. Perhaps the kidney problem was not created that morning. The blood test simply revealed something that the body had been quietly managing. For years, the kidneys may have been compensating. The remaining healthy tissue may have been working harder. The person may have continued living normally, and because the body was still maintaining enough balance, there was no dramatic signal forcing them to stop and investigate. But compensation has a limit. The crucial question is what happens when the kidneys can no longer compensate enough? When does a silent laboratory abnormality become something a person can actually feel? And why do some people remain stable while others experience a gradual decline? That is where the story becomes much more complicated. Because the kidney is not an isolated organ, it is connected to blood pressure, to blood vessels, to blood sugar, to inflammation, to the heart, and even to the medications people may need for completely different diseases. The kidneys sit at the center of a much larger network, and once that network begins to fail, the consequences can travel far beyond the kidneys themselves. So the mystery is not simply why kidney disease can remain silent. The deeper mystery is this: how long can the kidneys keep hiding the damage before the rest of the body finally notices? That is the question we need to answer next. For a long time, the kidneys can be remarkably quiet. They can lose some function, adapt to the change, and continue doing enough work to keep the rest of the body relatively stable. But there is a point when compensation becomes harder, and when that happens, the effects may no longer stay hidden. The first clues can be surprisingly ordinary: swelling around the ankles, changes in urination, persistent tiredness, nausea, poor appetite, difficulty concentrating. But even here, there is an important distinction. These symptoms are not unique to kidney disease. Tiredness can have dozens of causes. Swelling can come from problems involving the heart, liver, veins, medications, or other conditions. Changes in urination can happen for many reasons, so symptoms alone rarely solve the mystery. Doctors need the pattern of evidence: blood tests, urine tests, blood pressure measurements, medical history, and sometimes imaging or other specialized investigations. This is why kidney disease is often described as a condition that needs to be measured, not simply felt. And one of the most important measurements is eGFR. It gives doctors an estimate of how effectively the kidneys are filtering blood. But even eGFR is not a simple countdown clock. A single result does not necessarily tell the entire story. Kidney function can fluctuate, laboratory results have limitations, and doctors often need repeated measurements over time to understand whether kidney function is actually declining. That idea of time may be one of the most important pieces of the puzzle. Imagine seeing someone's kidney function today. Now imagine seeing the same person's results from 3 years ago. The second picture could be completely different. A stable number may tell one story. A number that has been steadily falling may tell another. This is why doctors often care about trends rather than isolated results. And there is another measurement that can reveal something different: albumin in the urine. If kidney filters become damaged, albumin can leak into the urine. Doctors can measure this using a urine albumin to creatinine ratio. That means a person can potentially have evidence of kidney damage even when the overall filtration rate has not yet fallen dramatically. In other words, there is more than one way to detect the beginning of kidney trouble. This is important because the kidneys do not fail like a light switch. There is usually a process, a gradual accumulation of damage, a period of compensation, a period where laboratory abnormalities may appear, and, in some people, a later decline in function. But the speed of that process is not the same for everyone. Some people remain relatively stable for years, others experience faster progression, and researchers are still trying to understand exactly why. Part of the answer appears to involve the original cause of the kidney damage, but biology is more complicated than that. Blood pressure can influence progression. Diabetes can influence progression. Age, genetics, cardiovascular health, inflammation, and other conditions can also play roles. Even the structure of the kidney itself can matter. This is why two people with what appears to be the same diagnosis may have very different futures. And that brings us to one of the most misunderstood parts of the story. Kidney disease does not automatically mean kidney failure. Those are not interchangeable terms. Chronic kidney disease can exist at different stages and levels of severity. Some people have relatively mild abnormalities. Others have substantial loss of kidney function. Kidney failure represents a much more advanced stage, when the kidneys can no longer adequately meet the body's needs. That distinction matters because hearing the words kidney disease can make people imagine the worst possible outcome. But a diagnosis is not a prediction of exactly what will happen. It is information about where the body is now, and that information can be valuable. Because once doctors know kidney function is changing, they can investigate the cause and monitor the trajectory. This is where early detection becomes more than a medical statistic. It becomes a way of seeing the future more clearly. Not predicting it perfectly, but seeing the direction. Consider someone with long-standing high blood pressure. For years, they may feel completely fine, but every day, the heart pushes blood through the vascular system at an elevated pressure. The kidneys contain an enormous network of tiny blood vessels. Over time, persistent high blood pressure can damage these structures. The process can be silent. Then one day, a routine blood test reveals reduced kidney function. The test did not suddenly create the disease. It revealed evidence of a process that may have been developing quietly. Now consider diabetes. High blood glucose over long periods can damage the small blood vessels involved in kidney filtration. Again, the process may begin without dramatic symptoms. Urine testing may eventually detect albumin. Blood tests may reveal changes in kidney function. And once again, the laboratory becomes the messenger. But not every kidney story begins with diabetes or hypertension. Some begin with autoimmune disease, some with inherited disorders, some with repeated episodes of acute kidney injury, some with structural abnormalities, some with infections or other medical conditions, and sometimes, despite careful investigation, the exact cause remains uncertain. This uncertainty is worth acknowledging. Medicine is powerful, but it does not always produce a simple answer. Researchers are still studying why certain kidneys appear more vulnerable than others. They are investigating how inflammation, blood vessel health, genetics, metabolic disease, and the kidney's own repair mechanisms interact. They are also studying why some people progress slowly while others decline more quickly. These are not minor details. They may eventually change how kidney disease is detected and classified. Instead of simply asking how much kidney function has been lost, future medicine may increasingly ask, what kind of damage is occurring? Why is it happening? How quickly is it progressing? And perhaps most importantly, can the process be interrupted before the kidneys lose too much function? That final question is where the story becomes hopeful, because the kidney's silence can be frightening, but it can also create an opportunity. If kidney disease is detected before severe symptoms appear, there may be more time to understand its cause, monitor changes, and manage the conditions contributing to kidney damage. This does not mean every case can be reversed. It cannot. Some kidney diseases are progressive despite treatment. Some damage may be permanent, and no single intervention works for everyone. But early knowledge can change medical decision-making. It can turn a mystery into something that can be monitored, and monitoring can reveal whether the situation is stable, improving, or getting worse. That is why routine medical testing can matter even when someone feels healthy. Not because everyone should assume something is wrong, but because some important diseases do not reliably announce themselves through symptoms. The kidneys are one of the clearest examples. They can continue working while damage develops. They can compensate. They can remain quiet. And by the time symptoms become obvious, the underlying disease may already be advanced. So return to the person from the beginning. They walked into the doctor's office expecting an ordinary appointment. They did not feel sick. They were not looking for kidney disease. But a blood test revealed something their body had not clearly announced. That result did not tell them exactly what would happen next. It did something more useful. It gave doctors a reason to investigate. And that may be the central lesson of this entire mystery. The kidneys do not always fail without warning. Sometimes the warning is simply too quiet to notice. A laboratory number, a trace of protein in urine, a blood pressure measurement, a trend that only becomes visible when today's result is compared with yesterday's. The danger is not that the kidneys are secretly destined to fail. The danger is assuming that feeling healthy is enough to prove they are healthy. At the same time, fear is not the answer. Kidney disease is complex. Not every abnormal test means permanent damage. Not every person with chronic kidney disease progresses to kidney failure, and not every risk factor leads to the same outcome. The evidence points toward something more nuanced. The earlier a genuine kidney problem is recognized, the more information doctors have about what is happening and how quickly it is changing. And sometimes that information is the difference between discovering a problem after major damage has occurred and discovering it while there is still time to understand the story. So the mystery we started with has an answer. Why can kidneys start failing without warning? Because the kidneys are extraordinarily good at compensating. They can preserve enough function to keep the body operating normally while damage develops underneath the surface. But that silence is not absolute. The body leaves clues: blood, urine, blood pressure, trends over time. And when those clues are recognized early, the story does not have to end with kidney failure. It can become something different. A story of investigation, of monitoring, of understanding what caused the damage, and, when possible, of slowing the process before the kidneys reach the point where they can no longer compensate. If someone has concerns about kidney function, abnormal blood or urine tests, or risk factors such as diabetes or high blood pressure, The appropriate step is to discuss those findings with a qualified healthcare professional rather than starting, stopping, or changing treatment independently. Because the most important warning from the kidneys may not be something you feel. It may be something your doctor can measure. And sometimes, the quietest warning is the one worth listening to.